Joining us now are Chief Medical Correspondent Dr. Jon LaPook and Senior Political Analyst and 60 Minutes Correspondent John Dickerson. Good morning to both of you. Dr. LaPook, I want to go to you first and take advantage of that MD after your name. If the president were your patient right now, everyone wants to know, is he going to be okay? The course of this illness, that's what we're curious about. What would you be looking for? What should we be looking for in terms of knowing if the president is going to be doing well or not so well in this case?
Good morning, Tony. You know, statistically, he should do well, right? But he does have some risk factors of age and obesity. And if there's one thing we know about this virus, the one predictable thing about this virus is that it's unpredictable. So I think he's going to be watched very closely. You're going to look for any kind of signs. We all know what they are, fever, cough, and there are some other ones, loss of smell and diarrhea. The most important thing is he having any problem breathing? In terms of other symptoms, they're just going to be watching him very, very closely. And in terms of it being my patient, I know he's not my patient, but the trick here with a VIP is you treat the VIP just like every other patient. You get into trouble when you treat them differently.
We heard Dr. Agus mention earlier that the option for treatment is supportive care. What is that meant? What is meant by supportive care?
Supportive care just means making sure they're well hydrated, that they have good nutrition and things like that, because there's nothing that's been proven to help people in this situation yet in the early course when they're still feeling well. Of course, remdesivir and dexamethasone have been shown to be helpful in people who are sicker. It is possible that they could think about using something like monoclonal antibodies to try to give to somebody very early in the course, but that's not yet been proven to be effective or safe in this situation.
Major Garrett has made such a good point this morning, Jon LaPook, when he says we really need the White House to be transparent here. So what questions does the White House need to answer to the American people today to let us know how this is progressing and what is happening?
First of all, we need to know about the president's health and the first lady's health. We just need to know total transparency here. We can take it. We're grown-ups, so we just need to know the facts. It's reassuring, even if it's worrisome news, it's reassuring to know you're being leveled with. You're being told the truth, the whole truth, and nothing but the truth. And the other thing is to know the incubation period. The incubation period is 2 to 14 days. That means if I get infected today, I don't become infectious until 2 to 14 days from now. So then that's how you figure out who was infected, who was possibly exposed. And they have to do basic shoe leather public health measures, which is find people who were contacts, put them in quarantine, have them be in quarantine. And of course, the president and first lady, since they did test positive, they'll be in isolation.
Is it troubling to hear then that the president, after Hope Hicks had been diagnosed on Wednesday, that he went to a fundraiser in New Jersey and was around another group of people there?
Yeah, we do know that, it's this concept, and it's very hard for people to get their arms around it, of the incubation period, which means that if Hope Hicks tested positive on Wednesday, then she was probably infected at least 48 hours before then, and on an average 5 days from the time you're exposed to being infected. So do the math. They both could have been exposed to the same person. It's not necessarily that he got it from Hope Hicks, is that they could have both gotten it from somebody else, and both have been incubated. He could have been infected, but not yet infectious. And then once he became infectious, he, of course, could spread it to others.
Yeah, and
why it's so important to wear a mask all the time, especially indoors.
Yeah, and there are still so many questions at how many people in the White House area may have been infected. We don't know yet. John Dickerson, let me ask you, as much as the president seemed to be flirting with the coronavirus by not wearing a mask and going to big rallies, what was your first thought when you heard the news overnight?
Well, my first thought was we didn't have to wait long into October before we got our October surprise. My second thought was I hoped partisans wouldn't embrace their worst instincts in reacting to this. And the third one was that COVID sleeps for no man. I mean, COVID waits for no man. The president has downplayed the virus. He's mocked mask wearing as recently as in the debate. And yet the pandemic is relentless and does not care where it goes. And now it's gone inside the most protected building in America.
A lot of people will be wondering this morning about the president's ability to govern. How do you think this will affect that?
Well, it depends, of course, how bad the symptoms are and how just physically how drained he is. There are obviously protocols in place here for both short-term incapacitation, should it ever get to that, and we're nowhere near that. But also, the White House has an operating pattern But the question is, if somebody tries to take advantage of this, there are a lot of America's enemies circling around this election at the moment. And so it really depends both on his condition and the challenges he's faced with. But there's nothing in the evidence so far that would suggest that this should be a particular problem at this very moment.
John, we're all dealing with a lot of uncertainty this morning, and one of the big ifs is if the president takes a bad turn, what happens to the leadership in the White House? We've heard about the 25th Amendment. Can you tell us about what that protocol is and whether it's been used before in American history?
Well, it has been used before in very short duration. When Ronald Reagan had a colonoscopy, when George W. Bush did twice, and Mike Pence was on standby at least once to use it. There is a process for this. There will be a run-up period here where everybody can kind of figure out exactly what the protocols are. So there's a way to handle this should we ever get to that pass, which we're a long way away from at the moment.
Jon LaPook, I want to go back to you for a second. We're hearing that Vice President Mike Pence and his wife Karen have both tested negative. That's what we're hearing right now. That is breaking news. But I have a question about Joe Biden, because it has been reported that he tested negative, that the president tested negative on Tuesday before the debate. Is Joe Biden in any jeopardy, do you think?
You know, theoretically, he could be in jeopardy, right? Because remember that he tested negative on Tuesday, but he could have had a low level of virus there that didn't get picked up by the test. So he shouldn't be really in a lot of danger. The one thing that I thought of was that the president certainly had a lot of volume to his voice, and the louder you are, the more these little aerosols can go out across. But I think probably he's not in big danger. But the vice president's not out of the woods. Remember, the 2 to 14-day incubation period. So just because he tested negative today, he could still have gotten it, 4, 5, 6 days ago, anything more than 48 hours ago, from 2 to 14 days, and test positive tomorrow or the next day. So they have to keep watching him, and I suspect they'll probably keep testing him.
John Dickerson, as you said, it didn't take long for us to get the October surprise. How, if we can even anticipate at this point, do you think it's going to affect the campaigns of both candidates?
Well, it obviously takes the president off the campaign trail. That means he's not out there making the kind of news he wants. That's also a physical drain on him. When you talk to his aides, they talk about those rallies as if they are oxygen for him. So he'll be sort of down in that aspect. And also it keeps the campaign. This is why COVID waits for no one. It keeps that issue right at the center of the campaign and the president's response to it, which is not something that he wants at the center of the campaign, because polls have consistently shown that the country is disappointed with his handling of the issue. And then the question is, what happens with the next debate? How much is the vice presidential debate taken over by this issue? All of which are complicated questions, and ones that the Trump campaign doesn't want to be talking about.
All right, Dr. Jon LaPook and John Dickerson with the politics and the prognosis this morning with this major news. Thank you both.